Howdy, this presentation in Psychology and Film looks into the psychological disorder portrayed in the film Me, Myself, and Irene. Charlie Bailey Gates is a veteran Rhode Island State Police trooper who has been taken advantage of by others, starting with his former wife, Layla. Despite his friends' warning of his wife's infidelity, Charlie refuses to accept the fact that she was in an affair, even after she gave birth to black children and eventually left him. In the present, Charlie is continually abused by others, and as a result of years of such treatment, Charlie develops a split personality named Hank, who deals with the confrontations that Charlie avoids. Emerging whenever Charlie is under extreme stress, Hank is an over-the-top, rude, and violent persona. According to the Diagnostic and Statistical Manual of Mental Health, Charlie has dissociative identity disorder 300.14, formerly known as multiple personality disorder. DID criterion A, which Charlie falls under, is described as a disruption of identity characterized by two or more distinct personality states. This disruption involves marked discontinuity in sense of self and sense of agency, accompanied by related alterations in affect, behavior, consciousness, memory, perception, cognition, and sensory motor functioning. Losing sense of self can be described as a person feeling as though he or she has become depersonalized from their self, their speech, and their actions, which they may feel powerless to stop and can leave them feeling disconnected. An example from the film would be any time that Hank is present instead of Charlie, like when a man starts laughing at Charlie when the soda machine robs him twice. Becoming angry, Hank takes over and beats up the man, something Charlie would never do. Losing sense of agency is characterized by strong emotions, impulses, and even speech or other actions that may just suddenly emerge, without a sense of personal ownership or control. Attitudes, outlooks, and personal preferences may suddenly shift and then shift back. An example from the movie would be the different reactions of both Charlie and Hank to the situation involving a little girl. Charlie is walking on the sidewalk and sees a little girl jumping rope in the middle of the street. He politely asks the girl to move out of the road and onto the sidewalk. She yells at him several times, and when she screams, he runs away briskly. On the complete opposite end of the spectrum, Hank comes up to the little girl and starts drowning her in a fountain until she submits to his authority. There is, however, one symptom that Charlie does not fully display that is characteristic of individuals with DID. This symptom is referred to as dissociative amnesia, described as gaps in remote memory of personal life events. This is somewhat portrayed in the film, though, because Charlie and Hank both do not remember anything that happens while the other personality is in control. On the other hand, both Charlie and Hank know about the situation regarding Charlie's ex-wife. One would think that Hank would have no previous knowledge of this, and yet he knows all about the situation and even feels the pain that Charlie feels. This is not typically observed in someone with this disorder. With any disorder, though, one is hopeful to be able to treat the symptoms with some sort of medical intervention. In the movie, Charlie is prescribed medication that he must take every 6 hours, and that gives him severe dry mouth. Although medication can be beneficial, I believe that there is another approach that could be more helpful to Charlie called psychotherapy. Psychotherapy usually involves helping individuals improve their relationship with others, prevent crises, and experience feelings that they are not comfortable having. And if needed, medication can be added to this to better help the individual. With any treatment plan, people want to know the projected outcomes. For the film, Charlie takes drugs in order to suppress Hank from coming out. This treatment's long-term effect would require Charlie to take a pill several times a day for the rest of his life, which is not really an ideal situation. In real life, on the other hand, therapy would give a patient the opportunity to work through his or her problems. Also, therapy could help patients develop skills to help them deal with their disorder, teaching them methods to help control all personalities involved. These two pros of psychotherapy are why I believe that it would be the best treatment option for Charlie. With every treatment plan comes concerns, and even more so ethical concerns, which are listed here. Concerns regarding the movie include adverse effects that could cause an increase in suicidal thoughts or action, stigma of people labeling someone who takes drugs, self-medication, alcohol use along with drugs, and doctors sometimes prescribe medications without proper evaluations and follow-ups. Concerns regarding psychotherapy include therapist competence, informed consent, confidentiality, dual relationships, and sexual relationships. For the most part, I would say that this movie does display an accurate portrayal of DID. The film is fairly accurate when showing that Charlie and Hank are two different people, sharing the same body but definitely not personalities. However, it is not accurate in the portrayal of Charlie being able to overcome Hank without any help of therapy or drugs. He does so by standing up to Hank in the end and thus permanently nullifying him. This film does influence how we see people with DID. Even though this film is more of a comedy, I think that the audience can see that we should view this disorder as a serious medical condition, one that should not be feared, but should try to be understood and helped.